Testing 1 2, test test test. Testing 1 2, 1 2 1 2. Testing 1 2 3 1 2 3. Testing 1 2 1 2 1 2. Testing 1 2. Testing 1 2 1 2. Testing 1 2 3 1 2 3. Still good. You're good.
Wow. Well, good afternoon, everyone, and welcome to our daily COVID-19 update briefing. Dr. Ezike and I are joined here in Peoria at OSF St. Francis Medical Center by Bob Anderson, the president of OSF, Dr. Michael Cruz, Chief Operating Officer of OSF Healthcare, and Monica Hendrickson, Administrator of the Peoria Department of Public Health, as well as Leader Jahan Gordon-Booth, the state representative from this area who I get to work with in Springfield on behalf of the entire state. The JUMP Simulation Center, from which we speak to you today, served as OSF's launching pad for one of the nation's first pandemic health worker programs. It's a public-private collaboration to deliver telehealth services to any central Illinoisan who needs it during the pandemic, and one of several that the Department of Healthcare and Family Services in Illinois deployed around the state earlier this year at the beginning of this pandemic. Throughout this partnership, we deliver safe, free COVID-19 care to thousands of patients, offering virtual consultations for the vast majority of people who recover from COVID-19 in their homes, thereby reducing the risk of community spread. This program remains in operation and is free to any Illinois resident. Those in need of COVID-19 home care can text CARE, C-A-R-E, and your zip code to 36363. Again, text CARE, C-A-R-E, and your zip code to 36363. This will automatically direct you to OSF Healthcare's program or one of the other two health systems that are providing this service, depending upon what part of the state you call home. The OSF hospital system has been an integral part of Illinois' COVID-19 response from the very beginning, offering innovative, quality care to those in need, whether in person, at the hospital, or through telehealth. And today we stand together again, this time to deliver a message to Peoria and beyond. Cases, positivity, hospitalizations are all rising across the state of Illinois, and we have got to reverse the trend and slow the spread of this virus. Peoria's Restore Illinois region, that's Region 2, is currently the best performing of our state's 11 Restore regions. But a 7.2% positivity average is nothing to write home about, and that's on top of a slight uptick in hospitalizations this month after leveling off in August and September. We've also watched that positivity trend up, down, and back up again in recent months, reaching a high of 7.7% average in early September, coming back down to below 5% on October 4th, and climbing back up over the last few weeks, reaching a 7.2% average as of this morning. I've said before that our knowledge of what works in the battle against this virus has grown significantly since the spring, but the virus isn't going away, and it's constantly looking for new hosts. So we need to use the tools that we have available to us to continue this fight. You hear me talk a lot about masks and social distance, but one of our greatest tools is testing. Testing, testing. People here in Peoria and all across Region 2 are taking advantage of the testing that we've ramped up and made available to you. I'm pleased to see that testing in Region 2 is up 20% in the last 2 weeks alone. In addition to the testing site at the Peoria Civic Center, which is open 8 a.m. to 4 p.m. 7 days a week, we're deploying 2 mobile teams to various parts of Region 2 throughout the week. Today and tomorrow in Bureau County, with additional stops in Peoria, Knox, and Rock Island counties through Sunday. Find the site nearest you at our website. That's dph.illinois.gov/testing. And then check back regularly, because we offer mobile sites in new locations all the time to meet local need. And remember, these tests are free and fast and available to anyone who shows up. Outside of Region 2, the remaining regions which have not triggered heightened mitigations are also trending in a bad direction. Region 11, the city of Chicago, is now seeing an average positivity rate of 7.7%. And regions 3 and 6 are both at 7.8%. And Region 9, Lake and McHenry counties, is reporting its first day of an average positivity rate above the 8% threshold for mitigations at 8.1%. If the region remains above the 8% threshold for the next 2 days, it could enter a period of additional mitigations, possibly later this week. We're seeing a national surge of coronavirus, and Illinois is not immune. Indeed, our neighboring states of Missouri, Iowa, and Wisconsin all have positivity rates and hospitalizations that are in the double digits, positivity rates anyway, and they're soaring. So it's perhaps not surprising that over the weekend, 2 more regions in Illinois, Region 4, Metro East, as well as Region 10, suburban Cook County, triggered our metrics for additional mitigations, meaning that starting Wednesday, 6 of our 11 Restore Illinois regions will be operating under our resurgence mitigation framework. As a result, those regions would reduce sizes of public gatherings to 25 people and temporarily close indoor dining and indoor bar service. If we all do our part by wearing a mask everywhere you go in public, keeping your distance, avoiding public gatherings, and washing your hands frequently, over the next 2 weeks, we can reduce new hospital admissions and reduce the positivity rate. That's what it will take so that we can help our businesses get back on their feet and help our kids go to school safely. Much like the 4 areas already operating under Tier 1 or Tier 2 of the plan, that's northwestern Illinois, southern Illinois, Will and Kankakee counties, DuPage and Kane counties, Metro East triggered our 8% positivity threshold, the second time it's done so since midsummer. Suburban Cook County, Region 10, is the first region in Illinois to trigger additional mitigations, not because of its positivity rate alone, but because its positivity rate and its COVID-related hospitalizations have both seen a sustained increase over the last 10 days, mirroring the concerning trends that we're seeing in our hospitals statewide. So no matter where in Illinois you call home, as you go about your daily lives, remember that this is not over. There seems to be a COVID storm on the rise, and we have to get prepared. In the last 24 hours, we've lost another 17 people in the battle with COVID-19. Those are people whose families thought that they would get to see them at the Thanksgiving table. These are our friends and our family members now gone from our lives. May their memories be for a blessing. There are currently more than 2,500 Illinoisans in the hospital fighting this virus. And unfortunately, because we now have so many new people getting infected, that number will likely rise over the coming weeks. Many of those people will survive, but many will have lasting damage to their lungs and other internal organs. Every day, dozens of them are dying. So when we talk about the importance of wearing a mask and keeping your distance, it's because we don't want you to become one of those who don't easily recover. So let's be good to one another. And for the remaining months until we have a vaccine or an effective treatment, let's follow the rules and keep each other safe. Please, Illinois, mask up, and we'll get through all of this together and to the other side. With that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Thank you, Governor. I'm going to echo much of what the governor has said, remembering that right now, treatment for COVID-19 is limited. There is no cure, but what we do have is prevention. The goal should not be to be lax with getting infected because the chances of survival are good. As we know, it's not clear who will succumb to this virus or not. Yes, it's true that our older members of society and people with pre-existing conditions are among the higher risk, but we have heard countless stories of individuals, even teenagers, with no known medical conditions that have succumbed to this virus. You've heard me say this and everyone a million times: wash your hands, watch your distance, and wear your mask. Just to be clear, it's not pick 2 of 3 or pick your favorite one, it's all of them. These measures are additive, and we need to do all of them to help spread the virus. I know I hear people say, well, you know, people die of car accidents, but we still drive. And in driving, we also institute all kinds of ways to limit the number of deaths from car accidents. We tell people to lower speed. There are speed limits. There are airbags. You have to wear your seatbelt. We don't want people driving while they're intoxicated or otherwise impaired. There are traffic signals. It's not just put one thing out there and then don't do the rest, or because there's an airbag, I won't put my seatbelt. Again, additive measures cause increase in safety. As a mother, as a human, I do care about individuals and I care about their health. As a public health official and a physician, of course, that's even more so the case. And so I'm drawing on that medical background and public health expertise to institute practices and measures that will help keep people safe. I've heard a few times now, it's not your job to protect people's lives. I'd have to push back on that. It absolutely is my job. Please just refer to the IDPH website and look up our mission. The mission of IDPH is to protect the health and wellness of the people of Illinois through the prevention of disease, through health promotion, through regulation, to prevent injury. So again, it's clearly stated on the website, it is my job to protect the health of the people of Illinois, and I'm committed to this important role that I've been privileged to serve in for the last year and a half. I can tell you that the number of cases, hospitalizations, people in intensive care, and people who are dying continues to increase. If what we're seeing today does not turn around, we are on a path to see more than 11,000 COVID deaths in Illinois this year. Since yesterday, we received a report of an additional 17 lives lost, as the governor mentioned, for a total now of 9,522 deaths. Today, we are reporting 4,729 new cases for a total of 378,985 total confirmed cases since the beginning of this pandemic. 2,638 individuals were reported to be in the hospital overnight. Of those, 589 were in the ICU and 238 were on ventilators. Of the nearly 4,700, almost 5,000, of the nearly 5,000 people that were identified as new cases, we know that over the coming weeks, certain percentage of those will end up in the hospital, a certain percentage of those will end up in the ICU. The amazing nurses and doctors and respiratory therapists and physician assistants will do everything in their power to minimize the number of those hospitalized and ICU patients that go on to lose their lives. But as valiant as their efforts may be, it might not be enough for all of them. But that's not the end of the story. The people who will get exposed to the virus tomorrow has not been determined. And that is where every one of us comes in. With our mask and our clean hands and our physical distancing, we can prevent exposure to this deadly virus tomorrow so that on the back end of that, there aren't additional individuals to get hospitalized and to have the healthcare workers fight for their lives and unfortunately, in some cases, lose that battle. Can we do that for one another? Can we limit the gatherings where spacing gets tricky and we can't minimize our spacing? Every individual has the power, and I would say the actual responsibility to do this, to help us stop the spread of this virus. Please join me in the mission of IDPH to protect the health and wellness of all of the people of Illinois. Please wear your mask, wash your hands, and watch your distance. Thank you. Buenas tardes, Peoria y Illinois. En este momento, el tratamiento para COVID-19 es limitado. No hay cura, pero lo que sí tenemos prevención. Me has escuchado a mí y a otros decir esto 1 millón de veces. Lávate las manos, mantenga su distancia y usa tu máscara. No es para elegir uno de esas acciones. Se necesita hacer los tres y todo el tiempo. ¿Por qué? Porque tenemos que proteger a los abuelitos, estudiantes, maestros, enfermeras, mecánicos y muchos más trabajadores que están ayudando a avanzar nuestro estado. Soy una doctora y un funcionario de salud pública. Me preocupo por toda nuestra gente y hago lo mejor para su salud. En eso baso mis recomendaciones. Tu salud es mi prioridad y prevención es la manera que necesito para prevenir más muertes. Desde ayer hemos perdido 17 vidas adicionales para un total de 9.522 muertes. Hoy informamos 4.729 casos nuevos de COVID-19 en Illinois para un total de 378.985 casos confirmados. Se informó que 2.638 personas en Illinois pasaron la noche en el hospital con COVID-19. De ellos, 589 pacientes estaban en la unidad de cuidados intensivos y 238 pacientes estaban en ventiladores. La verdad es que más personas serán hospitalizadas y más personas van a morir, pero podemos reducir ese número. Cada individuo tiene el poder y la responsabilidad de frenar la propagación del virus. Como doctora, mi consejo es sencillo. Practica los 3 M's. Usa su máscara, mantenga su distancia y lávese las manos. Es vital en nuestra lucha contra este virus. Muchísimas gracias para su apoyo. And with that, I will turn it over to Dr. Michael Cruz.
Muy bien, doctora. Hello, I'm Mike Cruz, Chief Operating Officer of OSF Healthcare, 14 Hospital System headquartered here in Peoria. Welcome. I'm also an emergency physician by trade. I've been in practice for 30 years. We collaborate with many hospitals throughout our regions and health departments throughout the state to share information and data regarding the COVID-19. I'll try not to duplicate anything that's been stated before me. We're all concerned about the alarming increases we're seeing when it comes to not only COVID cases, also numbers of those who've been hospitalized because of the severity of their illness. A check of the numbers this morning, as I often see, has shown that we have definitely escalated the number of patients who come to us. I could suggest that at least the 22 hospitals surrounding this area, all but 2 have patients with COVID-19. Our ICUs, in general, are pretty full, and so are their use of those ventilators. We've learned a lot from this spring, but these patients still require a fair amount of help when they come to see us in our hospitals. We are seeing people who span all ages. The virus does not discriminate. Some who are otherwise healthy individuals who have succumbed to this virus, as Dr. Zike has mentioned. The resources throughout our region and beyond are increasingly being dedicated to care for these individuals. So recall all the constraints with supply chain, PPE, space, and most important, staff to take care of us when we become ill. Something else we're abundantly aware of is that flu season is upon us. Every year has an impact on healthcare providers. Those are us who take care of ourselves and our communities when we're ill. We don't know what this year's flu season will look like. We do know that it's important for all who are able to get an influenza vaccine. We're urging everyone to help stop the spread of COVID by the 3 W's that were mentioned already about our wearing our mask, washing our hands, and watching our distance. We understand the past 7 to 8 months have been extremely tiring, troubling, and sometimes demoralizing. But this is a time when we have to double down. We need everyone's help to prevent further escalation of this pandemic in our area and to help us reduce the impact of our healthcare resources, which are being used fully at this time. I'll speak a little bit about the Pandemic Health Worker Program. Thank you, Governor, for supporting this effort. It's a scalable and virtual platform that has allowed us, since April of this year, to, in an innovative way, to take care of patients in some of the most untraditional hospital settings called your home, in which case we bring expertise of clinicians who are highly qualified in taking care of patients in their home-based setting. It minimizes the risk of community spread and allows those patients to be taken care of at home in a safe and convenient and accessible fashion. This program has been with us for quite some time. The Governor spoke to the hotline. We provide service to over 20,000 persons seeking virtual care throughout the Pandemic Health Worker Program, with approximately 4,000 clients that are currently enrolled in the program. This program has fielded over 89,000 calls concerning COVID-19. We shouldn't underestimate the impact that has had, as though patients would have traditionally come through emergency departments, prompt cares, urgent care settings, or primary care offices with family members. That would continue the spread of that infection. So it's really created an unintended consequence that's really hard to measure and fathom. It's also created access to mental health services via digital app to over 1,800 clients. Once again, the amount of stress that this infection has caused on many of us, mental services and mental health being one of them. There's been more than 89,000 people have called the COVID-19 hotline because of concerns about being infected. Think about that. How many phone calls have been made? How many visits have been prevented without necessary a need? As a result of the hotline and the PHW program, only 393 of those called sought care in an emergency department. Only 157 were actually admitted to a hospital. Once again, those are outcomes and performance that would be hard to argue with. Once again, I finish with the 3 things we need to continue to watch very closely, and we know it works, and it's in a prevention stage about our masks, our distance, and our washing of our hands frequently. With that, I end. I'd like to introduce the Public Health Administrator, Monica Hendrickson. Thank you.
Thank you for the introduction. Again, I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department. And on behalf of the Peoria County Board and the Peoria County Board of Health, I would like to thank Governor Pritzker and Dr. Ezike for their continued and steadfast leadership in this response. Peoria County has 4,638 cases, and we are sad to report 66 deaths to date, while our Tri-County region of Peoria, Tazewell, and Woodford are reporting 7,971 cases and 138 deaths to date. We're continuing to be trending in the wrong direction. In the past week, Peoria County has added 382 new cases, as well as losing 8 additional residents to this virus. Our county, compared to the previous week, is now averaging 55 new cases a day, which is a jump of 10 additional cases from just 1 week ago. Even more pronounced is that our Tri-County 7-day average for cases is now over 100. With an average of 105 cases each day, this is the highest our Tri-County has seen. Our own internal model at the Peoria City County Health Department indicates that we will end 2020 with close to 9,000 cases to date if we continue on this trajectory. To provide context, in just over 2 months, we will approximately double our current to-date total since our local response began in March. And this, sadly, is a rosy picture because it assumes that we stay on our current path. But the next 2 months bring more challenges. Colder weather means increased indoor activities, the holiday season and the want to gather, and our own fatigue related to this response. However, our community is and can be the solution. This is not a time for complacence. And yes, it will be hard work, and the weariness and struggles will continue to be a part of how we do and overcome in this response. But we don't have to do this alone. We can be all in by wearing a mask, practicing the social distancing, the good hygiene, getting your flu vaccine, and if you are under the weather, be it allergies or not, get tested and stay at home and isolate until your results come in. In Peoria County, as the governor mentioned, we have the advantage of testing. We have 2 community-based testing sites, one at the Civic Center as well as Heartland Health Services, our federally qualified health center. And again, even this week, we, in collaboration with the Illinois Department of Public Health, will be hosting a test site at Shore Acres Park in Chillicothe. And let's not forget the hospital and healthcare systems as well as our pharmacies. All of these testing sites are available to anyone, not just Peoria County residents. There is no reason why you cannot get tested. And once you do, again, we want to reiterate that you need to isolate until you get your results. The last step, for those that do test positive, is to pick up the phone. You will receive a phone call from either your local health department or the statewide contact tracing program, which has a 312 area code. The more information you provide us, the better we can respond and hopefully get ahead of this virus. I'm immensely proud to serve and live in this community. Peoria is a county that cares. Our residents want to do what is best for each other. And while the response continues to put strains on all of us, I trust our community to do the right thing for the health and benefit of all of us. Thank you, and with that, I'll turn it back to the governor.
Thank you very much. And just before I take questions from the media, I just want to say Monica is an example of the terrific leadership that we have around the state running our local public health departments. You see Dr. Ezike and I at the podium every day, but on the front lines every day are our administrators in the counties who are truly taking care of everyone at the local level, providing flu shots, making sure that people know where to get resources that they need if they have COVID-19 or if they're concerned that they may have it. And we're just very lucky to have some terrific administrators. I just want to say a special thank you to you, Monica. And so with that, I'm happy to take questions from members of the media. Yes, sir. Yep.
National headlines this past weekend, and you choked up on Friday giving out the COVID numbers. If you could just simply walk us through that before you went to your head and kind of explain to us what happened there.
I don't know. I just got overwhelmed. It's a culmination of a lot of months of frustration and maybe some fear and some discouragement at the route and the road that we've taken, despite some opportunities and chances to do better. So I'm encouraged. I got an overwhelming amount of support from people from throughout the state and actually internationally as well, saying that they all feel that kind of frustration. I felt maybe in retrospect it was some kind of cathartic release, and hopefully after that now we can put our boots back on and continue the fight against the fatigue and then fight against the virus as well.
Sure. What I would like to ask is last week you had mentioned that the state police was going to be going and issuing citations or tickets. Have they done that? Do you have any numbers on that? Do you know where it has been done? Can you give us any thoughts on that, please?
Yeah, thank you. And the answer is they have done that. I want to remind everybody that the state police can't patrol everywhere all the time in the state. Just to give you a sense for the size of our terrific state police force, and they really are. There are about 1,900 of our state troopers in the state, and they cover every inch of the 50,000 square miles of Illinois. And so we're very fortunate to have such a highly skilled, highly trained police force for the state. They can't get everywhere. But where we know we've got scofflaws, where we know there are bars and restaurants or others who are putting the public in danger, we have asked our state police to go to those areas. They have the ability through the regulation that was passed just a couple of months ago to issue first a warning, then a dispersal order, and then a citation if they have to go that far. Most businesses are compliant when they hear that they need to be and that they aren't, but some aren't. And so they are ultimately issued citations, and those citations are then taken to the state's attorneys of those counties. So we're going to continue to enforce in that way. We're also looking at those scofflaws that have liquor licenses, that have gaming licenses, and we have the ability to begin proceedings to remove those licenses if they're not following the rules. And we're taking that action as we move forward, as people may become non-compliant. We don't want to do that. I've been very reluctant to take that kind of action because it's hard to get your license back once you lose it. And I'm an advocate of small businesses. They're the lifeblood of our economy, and so any small business that is impacted in that way by COVID-19, I think we all want to be supportive of businesses, but we also want them to follow the rules.
Governor, with hospitalizations, are there any plans to turn McCormick Place back into hospitals, or any plans to create an adult hospital elsewhere?
We don't currently have the plan to turn the McCormick Place into a field hospital as it was in the spring. Remember that when the coronavirus first came around, and you saw the enormous spike that was taking place back then, we just didn't know where it would end. We didn't know whether a stay-at-home order would be enough. We didn't know that even though we were literally tied with the first in the nation to put a stay-at-home order in place, we didn't know if that would stem the tide fast enough. And indeed, many of the original models that were put in front of us showed that maybe it wouldn't be enough to stem that, to bring the curve down, to flatten the curve. We found that we were able to do that back in May. We believe that because I think we all have learned a great deal more. I look around this room, and I will remind everybody that back in March, nobody in a room like this was wearing a mask. Today, everybody in this room is wearing a mask, thank goodness. That doesn't mean everybody in the state is wearing a mask, however. We need everybody to understand that that is a vitally, vitally important thing for people to do, wearing a mask, keeping your distance. We keep saying these things because it works, So we have the ability, by limiting capacity at certain locations, like bars and restaurants, by everybody wearing a mask and so on, to avoid the need for field hospitals. But we've kept warm at least one facility right now in suburban Cook County, but we have the ability, if we need to go and fire up a field hospital. It's not an easy thing to do. It's an expensive thing to do, but it would be something, if it were necessary, we would do. But hospitals, I have to say, have learned a great deal as well. And so I believe we will be able to avoid something like that.
What facility were you referring to that you were keeping on? Sorry, just a follow-up question. What facility were you referring to?
Metro South.
This may be a question for the governor or for Dr. Ezike, but I know locally here in the Peoria area, we've seen contact tracing has shown that a lot of the spread is happening due to small gatherings of people, family, friends, that COVID fatigue sets in. There's more complacency, people feel more comfortable and they're not taking those precautions. I just want to know if statewide is contact tracing showing that's the trend as well, that more of the spread's happening due to small gatherings.
It's what you described. Sorry for everybody who didn't hear the question. I'll repeat it, which is that we've said before that we've seen outbreaks, for example, in this region as a result of small gatherings in people's homes. Are we seeing that elsewhere in the state? Is that your question? And the answer is yes, we're seeing it elsewhere in the state. Indeed, if you just turn on any of the national news stations, you'll hear the same thing is going on across the country. Many people feel like, well, if I can't go to a public place and not wear my mask and enjoy myself in that public place, I'm going to invite a bunch of people over to my house and avoid any of the mitigations. And the reality is that that is precisely now where we see much of the spread. I think that's the number one spreading location I'm turning to Dr. Zike to make sure I don't get this wrong, but I believe that most of the named locations where people are having gatherings, not wearing a mask and so on, and potentially could have caught coronavirus is the small gatherings in a home or in a private setting. Doctor, did I say that correctly? I want to make sure we get the facts correct, so go ahead.
We have brought on a new platform that we use to collect all this information from the people who are identified as cases. And so, we have different, we have like a drop-down menu of which we try to find in the time that they would have caught the virus, where exactly were they? And so a lot of the common things that come up will be this private gatherings, it's also bars and restaurants, it's work, it's school. And so as we look at the commonalities, as we look from region to region, we keep seeing those same things. And so, yes, we know that private gatherings, which, in people's homes, if they don't require it as a rule within their home, those are likely to be without distancing and also without masking. And that obviously portends a significant risk for continued spread.
And let me I want to add one more thing, and we'll take the last question here. Just one more thing to that, which is we're heading into holiday season. We're about to have Halloween, Thanksgiving, Eid, Christmas, Hanukkah, and so on. And unfortunately, this is a moment when people let their guard down. They want to have private gatherings. I understand that. I do that every year, too, with my family. And with friends. And unfortunately, this is a time when we all need to be very, very careful. That doesn't mean you can't get together with people. But if you're going to bring people into your home, that's your pod. That's the place that you're safest with the people that you live with. If you're going to bring people who don't live with you, who you don't know exactly where they've been, you may love them, you may like them, they're your friends, but you're going to bring them into your home, you don't know where they've been. Please wear your mask, keep some distance. 6 feet of distance. You can do that. This is an odd year. I understand it will be a strange circumstance perhaps this year, but this is exactly what we want to make sure to keep you safe from, is the transmission of the virus in these small, packed, small home group settings. And that's exactly the season that we're heading into. Yes, sir. Oh, this right here, I'm sorry.
Governor Pritzker have prioritized health Illinoisans for the stimulation of the state's economy, with increased mitigation efforts being imposed already in some parts of the state and some coming down soon in other parts. At what point does the economy become a priority?
The economy is already a priority, and I think I reject the premise of the question, the idea that this is a complete trade-off between keeping you healthy and making sure that we have an economy that's moving forward. We are making, it's absolutely accurate to say that in the process of trying to keep the state healthy and to prevent deaths in the state, we have had to limit gatherings. We've had to do things that have a deleterious effect on certain kinds of businesses. And we've also, at the same time, provided support for those businesses. We have a $220 million program called Business Interruption Grants that is available for small businesses. They should go to our dceo.illinois.gov website to access applications for, they're called big grants, business interruption grants, for businesses that are affected by COVID. We've created programs to support child care centers, to support other kinds of businesses across the state, to keep jobs going and so on. This virus is what's causing an economic hardship on people, not just in Illinois, but all across the nation. There is not a state that is thriving during this COVID-19 crisis. None. And we have to deal with COVID-19 before we truly get back on track to growing this economy. We were on our way to growing this economy in a significant way before COVID got here. Our unemployment rate had come down and down and down and finally matched, what we had been above before I came into office, in fact, but we had been above the national unemployment rate. We finally had brought it to the national unemployment rate, and we're getting it down below the average unemployment rate in the country when COVID-19 hit. So, look, we're affected by COVID-19 from an economic perspective. There's no doubt about it. I'm working hard to get Washington, D.C. to do for states and local governments what they have done for big businesses already. It's time to save the jobs of police and firefighters, nurses, people who pave your streets, and so on. We just have to step up and make sure that we're maintaining our health while we're also keeping our economy going.
Thank you, everyone.